Since the pandemic began, we've seen growing evidence that obesity is a serious risk factor for COVID-19. Studies even show the COVID vaccine may not work as well on those carrying too much weight. The United Kingdom made weight loss part of its national anti-COVID strategy. And so today we're going 360. Should our government tell people to lose weight? Here's Denver 7's Nicole Brady.
You know, in this day and age, you should probably have a mask.
Lately, we've seen how some people feel about being told to do anything, even if it's supposed to be good for them.
Hi, everyone. I work for Costco, and I'm asking this member to put on a mask because that is our company policy. So either wear the mask
And I'm not doing it because I woke up in a free country.
A free country where we're free to eat what we want mostly and to exercise or not exercise as we choose. But in this free country, the majority of Americans are overweight. Over 40% are obese.
Like, I think many people, I struggle with my weight, go up and down.
It's not just the U.S. After British Prime Minister Boris Johnson was hospitalized with COVID, he blamed his weight and launched a nationwide campaign with measures like a ban on junk food commercials before 9 p.m. States in Mexico are banning junk food sales to children, citing the connection between obesity and the virus. So should the U.S. make weight loss part of its pandemic response? We're going 360 with perspectives from a public health expert, a bariatric surgeon, a diet and fitness coach, her clients who are trying to lose weight, and an advocate for a group that's disproportionately affected by obesity, diabetes, and COVID-19. The responsibility for obesity can be pointed in many directions: government, private industry, and of course, the individual.
I put on the COVID-19 and I was like, we have to lose this weight.
Like many people, Yvonne Miranda has gained weight since the pandemic began. She blames herself.
I think the will is there about 70% of the time, but it's really hard to say no when someone puts a cupcake in front of your face.
5, 6.
Her fiance also wants to lose about 30 pounds. They hold each other accountable, but Rudy Arzola isn't so sure people want the government telling them to put down that donut.
Government coming in and doing it, a lot of people will just shun that and say, no, it's my privacy, it's my own body, it's on my own life.
Denver bariatric surgeon Michael Snyder agrees that weight is personal, but says it's not that simple for his obese and morbidly obese patients who turn to surgery.
If you've got a BMI of 35 to 40, 75 plus pounds to lose, the chances of you losing weight and keeping it off on your own is about 1 to 3% over 10 years.
Dr. Snyder sees this largely as a medical problem that's been muddled by our society's tendency to shame and judge people for their weight.
Most people with notable weight issues don't necessarily eat that much more. They're just loaded to gain weight, okay, genetically. So when we talk about treating, let's just treat it like a medical problem and move on.
A medical problem, yes, but Metro State University professor Aaron Seedorf says obesity is a public health issue. For one thing, it costs our whole society.
We also know that healthcare is such a high aspect of our gross domestic product. In fact, it's 18% in 2017.
She says we need environments that allow people to make healthy choices, and that has to come from the government and private sector.
I do think that businesses are taking on some responsibility, but again, it's got to be, we've got to have multiple ways to address these very, very difficult challenges.
In some communities, the challenges are so intertwining, the deck seems stacked against the individual.
You know, if you can't afford healthy food, you're going to be more obese. If you don't have safe places to exercise and walk, you're going to be obese. If you're working 3 or 4 jobs, you're not going to have time to really for your self-care.
Denver's Center for African American Health is well aware their community is being disproportionately affected by the virus, just like it's been affected by so many other chronic diseases. Johnson welcomes government intervention as long as it comes with actions and opportunities.
Because we're talking about communities where there hasn't been opportunities for choice. You know, if I'm living in a neighborhood that's a food desert, or if I have to ride 2 buses to get an orange, but fast food is easily available, you're living in a system where you don't have these opportunities. It's on you to create it.
There's no one-size-fits-all solution to slimming down our nation. Even a trainer like Ashley Van Buskirk, someone paid to help people lose weight, knows she's not their mother.
I can't just tell them to start doing things and it doesn't fit in their life or it's not realistic for them. So what works for me might not work for you, it might not work for my clients. So I really have to look at their individual lifestyle factors and helping them plan.
No one can tell you what to do, but especially right now, we should show each other we care.
Obviously the fiance had a big part of it. I'm trying to be supportive.
Nicole Brady, Denver 7.